Now, as the last speaker, we will ask Dr. Arun Sethi, and he will give us a brief overview of the design planning for eye hospitals, the future.
Thank you very much, Dr. Debashish, and thank you all for being so patient. And we know we're running out of time, so this is going to be a very, very brief talk. How many in this hall actually have their own eye hospitals? Can you raise your hand, or their own practice? Oh, very good. How many of you have recently built a hospital or are planning to build one? Very good. So this is a talk for you. Actually, this should have been given to Dr. Debashish because he builds one hospital every year, but they've given it to me. So what is the basic purpose? That's very interesting that if you see the design that we have, your limitation in India is the cost of the land. It eats up all the cost of the hospital. So it's very important when you're planning something, you should plan 10 to 15 years in advance, or you should leave the city and go out and wait for the community to come. This is what we did. So you see here that green patch over there, I don't have a pointer, is the hospital site of 1.25 acres, and that is in the community which has now started developing, and the rate of the land there today is 2 lakhs a square yard. So imagine we have 6,000 square yards. So the first intention is to sell the land rather than go for a headache of a hospital. The second intention, if you want to do community service, you have to do it. So this is how the approach of the super highways that are coming up, Dwarka Expressway and all are. And then if you see, this is now in India, they don't give you land as you want it. You have to take what you get. So the land that they gave us is on 3 sides open, and you can see that there's a marking where you can build, where you cannot build, the circulation of the fire engines and so on. But what is more interesting is that there are even passages through the land which have to be given to the villagers who stay around when there are no villages around. So this plan was made by an architect whose father made our present hospital in the United States in Gurgaon. And this is the second stage of that which he has done. And it's interesting that because it's a big project and there's always a shortage of funds, so we decided, I and my wife, that we will do the minimum required to get the clearances, which is around 16,000 square feet, and then scale it up as we go along, depending on the patients who come. So you can see the design now. This is a very American design because this talks of having a lane system. In America, the ophthalmologist goes from room to room where the optom works up. Here, the patient comes to the ophthalmologist. So their logic is that it saves time. Also, it saves time for the patient because they don't, especially when they're old or in a wheelchair, putting them on one chair and taking them off and all those things. So as they talked of ROI and all those things are coming into the picture. So these are the new systems that they're doing it. So you can see that one floor is dedicated to ophthalmology, one floor is dedicated to multi-speciality, and then we have a floor which will be designed just to keep vacant. Now, why have we kept a vacant floor? This idea we got from Arun people because whenever they build a hospital, they build 2 middle floors which are vacant. And the logic is as you scale up, you can design what you do with it. Because later on to do civil work is very difficult. Sorry. So this is the design of an operating theater floor. It's a small design. The idea is that the theaters should be completely sterile, and the movement of the patient to the theater and back should be simple and elegant. And we have daycare beds. The idea is in the beginning we'll open in the morning at 8 and close at night. That will keep our costs under control, management systems in place, because most of the time, the first 3 years, you only lose money because there are not enough patients. So that is the whole idea of doing it in this manner. So we have one dedicated to ophthalmology, one dedicated to multi-speciality, one would be a femto LASIK kind of a thing, and one we are looking at is from an OB-GYN point of view, a birthing suite. So you can see some of the elevations. But what is good about working with American architects is they give you everything in one package. What is horrible is that their systems don't work in India. And then you have to go to the local architect, who makes it confusing. Now, if you see, there were rastas, there were triangular plots. So they created a very nice system of a yoga center, of a wellness center, and also staff quarters in such a limited space. So you can utilize the space adequately and you can use it in a way that is interesting for you, and you can be in a campus rather than having to travel on congested roads. So with that, we'd like to thank you for a short presentation, and I think I should be given a special thanks by the audience for finishing in less than 2.5 minutes.